3 years ago, we published a plastic surgery facial analysis on Anne Hathaway. Let's take another look at Anne and see what may have changed over the past 3 years. But let's first summarize the findings from the last video. In terms of her natural beauty features, she has a low hairline. She has an orbicularis oculi muscle prominence of the lower eyelid. She has some nostril show with mild tip bulbosity. And she has a well-defined philtrum and cupid's bow. She has a slight upper central lip gap and great upper and lower lip volume. Anne also has strong cheekbone and chin structure. Now, as far as some of the changes that we noted in our last video, here's a summary. In 2018, at the age of 36, we saw more lateral upper lid hooding and some early brow descent. In 2021, at the age of 39, we noticed that this may have been when Anne introduced some Botox to the forehead, glabella, and crow's feet. In 2023, at the age of 41, we saw some early minimal signs of lower face droop. And the conclusion of the last video's analysis was that we saw no signs of obvious cosmetic procedures other than the Botox that I mentioned. The question is, has anything changed since 2023? Let's take a look. And please make sure to subscribe to this channel if you enjoy this type of content. In 2024, at the age of 42, here are some of the aging changes that I'm seeing. There's some mild brow ptosis. There's also lateral upper eyelid hooding. We see that the lower eyelid is developing some crepey skin, and there's also reduced cupid's bow definition. I also noticed that the upper lip to lower lip proportion has increased over the years. When you compare back to Anne at age 17, you can see that she used to have a lower lip that was larger than the upper lip, but that ratio has essentially flipped. That would suggest potential lip filler, because naturally we usually don't see this changing of proportions as people age. The lips tend to get more thin and deflated with time, but if your bottom lip was your larger lip, you usually maintain that as you age. In 2025, at the age of 43, what I'm noticing here are some signs of a potential brow lift with or without an upper blepharoplasty. And I'll tell you why I have that suspicion. Her hairline looks to be a bit higher than it was previously. Most forms of brow lifting, including the popular endoscopic approach, does tend to increase the height of our hairline. Her eyebrows now look to be more lifted. She has increased supratarsal show, which is that platform of the upper eyelid. And her infrabrow space, or the space just beneath the eyebrow itself, has increased. It now looks to be larger than when Anne was 28 years old. Also, when you compare pictures of Anne at age 43 to Anne when she was 28, you can see increased lateral cheek fullness. This suggests that she may have had some cheek filler to increase the lateral cheek fullness. And again, when you look at Anne's lips, you can see that the upper lip is now fuller than when she was in her 20s. In 2026, still at the age of 43, you can see the changes that are occurring at the left frontotemporal corner of Anne's hairline. This is a common place where women can experience hair loss. Usually, hormonal changes will unmask underlying androgenetic alopecia, and that's an area that's highly susceptible to the effects of DHT. And that's one of the reasons why we incorporate DHT blockers in our hair care formulations at Feel Confident. And in our 3-month clinical study looking at our shampoo and conditioner on the effects of people's hair, we found a 40% reduction of shedding, along with a 30% increase in scalp hydration. And I would love for you to try our Feel Confident thickening shampoo. If you want us to send you a free travel-sized bottle of our award-winning shampoo, please do the following. Sign up for our newsletter at feelconfident.com. Follow feelconfident.official on Instagram. And email support@feelconfident.com with your shipping information and your Instagram handle. And you must be located in the United States to receive this special offer. Thank you very much for supporting my hair care brand, Feel Confident. In 2026, still at the age of 43, I see no obvious signs of a facelift. And she recently told Elle magazine that she has never had a facelift, but said that she might still get one day. And I think she's telling the truth in this case. She also gave away a beauty hack that she recently used on the red carpet, which was just 2 braids.
What do you call what's going on right now?
This is The Witches 2, The Return of the Grand Eye Witch. She figured out mouse life and she's back. All right, drum roll, please. Orlo, show them our secret.
We do one on each side, and we bring it together in the back.
And you look a little bit more awake. That's the trick.
Keep in mind that one of the risks of using this type of braid trick is that you're pulling quite a bit on the hair. As you do that, you can sometimes get what's called traction alopecia, which is where you're putting stress on the hair follicles, increasing inflammation, and sometimes creating hair loss. This can be a scarring type of alopecia where the hair is permanently gone. And then some people actually come to me for hair transplants to try to improve the appearance of that lost hair. It's better to avoid tight hairstyles so you don't run the risk of developing traction alopecia. And I think the braid trick is probably helping tighten up the upper face and the mid face for Anne. But I also think that a brow lift and an upper bleph may have helped as well. Remember that a facelift implies more lower face and neck tightening, and that's usually a separate procedure from when we talk about lifting the upper face, which is where brow lifting comes in. Sometimes facelifting and brow lifting can be combined during the same surgery, but they're still distinct procedures and can be performed separately as well. Some people choose to address the upper face aging first, and then in the future address the lower face and mid face. Other people choose to address these aging changes altogether. It depends on your facial characteristics and your goals and your budget. There's a lot of things that go into these different elements. Some people like to find a doctor that does all of it at once. Other people search for a narrow specialist in each of these different procedures to try to get the best possible outcome. In my practice, for example, the only types of surgeries that I offer are hair and lip cosmetic surgeries. So some people come to me for a lip lift, for example, and that might be before they consider a facelift or sometimes after they get a facelift and they're looking to now shorten that philtrum. And while their surgeon may have offered them a lip lift, they choose to come to me because that's my narrow subspecialty. I think discussing some of these beauty details, especially in the context of celebrities, is important because of the influence that they wield. And people will go out there and seek out different procedures based on what they think a celebrity may have had done. So I think it's good to unpack some of these potential situations and really discuss them openly so that people are not fooled into thinking that something was done or wasn't done. And of course, there's going to be some level of speculation, but there's a lot that we can deduce by analyzing some of these photos over the years. And then people get to make their own decision on what they think may have happened. I think Anne looks great, and she should continue following her inner compass on what feels right aesthetically moving forward.